Assalamualaikum and good day, students. So today's session is on the practical of the gross anatomy of the lower urinary tract. That includes the urinary bladder, not the gallbladder, but the urinary bladder and the urethra. So firstly, let's concentrate on the urinary bladder first. So this model is the male pelvis model because here you can see there's the penis and the scrotum, so that's male. So in this pelvic region here, you can see the most anterior structure here is the bladder. On the superior surface of the bladder here, you can see there's a pink lining here. This is the peritoneum. So peritoneum covers the superior surface of the bladder. So bladder is divided into 4 parts. Firstly here, the anterior-most part of the bladder is the apex. And you can see there's a structure here that attaches to the apex, and that's the median umbilical ligament attaches to the apex of the bladder. The second part of the bladder is the body of the bladder. Part of it has been removed, so that's why you can see the inside of the bladder. The third part of the bladder here, posteriorly, the posterior wall here is the fundus, also known as base. And lastly, the most inferior part of the bladder, the fourth part, is the neck of the bladder. Neck of bladder here, you can see it's surrounded by smooth muscle here. This smooth muscle forms the internal urethral sphincter. And neck of bladder, you can see it surrounds the internal urethral orifice, opening of the urethra here. And also it surrounds the intramural urethra. Okay. Now you can see here the bladder has a thick muscular wall. What type of muscle? Is the smooth muscle. And this muscle is called the detrusor muscle. Okay, now let's have a look on the inside of the bladder. Here, on the inside of the bladder, the internal surface of the bladder, you can see mucosa. And the mucosa forms folds. You can see here, folds of mucosa. These folds of mucosa are known as rugae. Rugae. Rugae disappears when the bladder is full, when the bladder expands. But at the trigon of the bladder, now let's have a look at the inside of the bladder here. Can you see this trigon of the bladder? Here, it is a triangular area on the internal surface of the fundus. Okay, mucosa at the trigon here, it is not folded. It is smooth. It is always smooth. There is no rugae at this trigon. So let's have a look at much more detail. This trigon, triangular area, inverted triangular area, upside down triangle on the internal surface of the fundus. You can see its superolateral angle here. There's an opening of urethra, and this is the right opening of urethra. The left one has been removed. Okay, the inferior angle of the trigon is you'll find the opening of the urethra, internal urethral orifice. And the superior border, can you see the superior border of the trigon here? It is prominent because it's a muscular ridge, and it extends from this urethral opening to the other urethral opening. That's why it's called the interuretary ridge. So that's the trigon. And the mucosa is smooth at the trigon. Now let's have a look at the relations of the bladder. So anterior to the bladder here, you can see here cartilage here. And this is the pubic symphysis. And also anterior to the bladder, you can see bone. This is pubic bone. Lateral to the bladder, still you can see the pubic bone. And inferior to the bladder, here you can see, here's the prostate, inferior to the bladder, and Down here is the pelvic diaphragm. Okay, posterior to the bladder. Now let's have a look posterior to the bladder. Here you can see this is the seminal vesicle. And also posterior to the bladder, here you can see the rectum. Ductus deferens you cannot see in this model. Superior to the bladder, here you can see sigmoid colon. And over here you should find the calls of the small intestine. Are not present in this model. Okay, now let's have a look at the urethra, the male urethra. Okay, male urethra, it extends from the internal urethral orifice. And here's the male urethra. Ends at the external urethral orifice. Okay, again I repeat, starts from the internal urethral orifice and ends at the external urethral orifice. So that's the urethra, and in male, the urethra is divided into 4 parts. Okay, the first part is the intramural urethra. Intramural urethra, it is surrounded by the neck of bladder. And here you can see smooth muscle here that forms the internal urethral sphincter. So you can see the intramural bladder, it descends, intramural urethra, it descends through the neck of the bladder. Okay. After that, the second part of the urethra, here is called the prostatic urethra because it descends through the prostate. Here you can you see this duct here? This duct is the ejaculatory duct. It passes through the prostate, and the ejaculatory duct opens at the prostatic urethra. Okay, so that's the prostatic urethra. The third part of the urethra is the membranous urethra, or also called intermediate urethra, that is not seen here. It's not shown in this model. And the fourth part of the urethra down here is the spongy urethra. You can only see part of it here. So this is spongy urethra that ends at the external urethral orifice. So you can see that the spongy urethra, it is in the penis, and that's why it's also called the penile urethra. Okay, there's a part of the spongy urethra here that it is enlarged, and this spongy urethra that is enlarged, it is in the glans penis, the distal end of the penis. This part of spongy urethra that is expanded here, that is enlarged, is called the navicular fossa. I forgot to inform you that spongy urethra here, it is surrounded by the corpus spongiosum. Here you can see purple in color. That's the corpus spongiosum of the penis, surrounding the spongy urethra. Okay, so that's for the male urinary bladder and male urethra. Okay students, now we have the model female pelvis. So you can see that it's female because there's no penis, there's no scrotum, but you can see here there's the uterus. So here's the anterior, and this is posterior because you can see there's a buttock here. And this is female pelvis lateral view. So you can see that in the pelvis, the anterior most structure here is the urinary bladder. And you can see that its superior surface here is covered by peritoneum. The pink lining here, that's the peritoneum that covers the superior surface of the bladder. So as I told you, bladder consists of 4 parts. Firstly, the apex of the bladder, the anterior-most part of the bladder, and you can see here a ligament attaches to the apex. It's the median umbilical ligament attaching to the apex of the bladder. And here's the body of the bladder. Posteriorly, here's the fundus, also called base of the bladder, and the inferior-most part is the neck of the bladder. So you can see the inside of the bladder, the internal surface of the bladder. Here you can see the mucosa forms folds, and these mucosal folds are called the rugae. Rugae. And you can see that the bladder has thick muscular wall, and this thick muscular wall, smooth muscle, is called the detrusor muscle. Okay, now let's have a look at the relations of the bladder in female. Anterior to the bladder, here you can see his cartilage. This is the pubic symphysis. Okay, posterior to the bladder, here you can see here's the vagina and here's the cervix. Superior to the bladder, here you'll find there's the uterus, and here you should find the coils of small intestine here, but not present in this model. Okay, now let's have a look at the female urethra here. You can see that the female urethra is short, starting at the internal urethral orifice and end at the external urethral orifice. And you can see posterior to the female urethra, there's the vagina. Okay, that's all that you can see on this model. Thank you, students. Have a nice day.